there are 3 conferences that happen. We have a Debra International Conference, we have a CLINET conference, which is for clinicians, and we have a research conference, which is for researchers. This year, they've all been in one year, and it's very important. On the research side, there are always new things to learn.
But I think it's really important when you're dealing with a rare disease like EB that people who might be working in the medical or the nursing field, as well as people who are from Debra organisations around the world, come together, because that's how you get the expertise and the strength of knowledge and the networking that's essential to try and improve care for people with EB and to raise awareness. So an event like this, we've got people from all around the world, sort of fundamentally important, just making contact between other people so that we can share our experiences and build on that to make things better.
And very important for Debra International as an umbrella organisation to be learning from each other and to be one entity. And I think as time goes on, that actually becomes more important.
Debra International Conferences are always very useful because they are a mixture of doctors, clinicians, nurses, all, let's say, professionals working around the world of EB, together with families. So it makes a different conference. I think there are a few in the world where you can see those kind of joint forces all together in one day to discuss about what's happening to the patient, what people are expecting from research, and what the doctors are doing on research. It's a good opportunity to share views, to ask questions to the doctor and to receive answers, but also for the family to come together and share their experiences.
It can feel very isolating, I think, when you're in a country, you're just starting up a Debra, or you've maybe been going for a while but are hitting hard times. And it can feel very isolating and very difficult. And to meet with other people who've been through the same thing, learn from their experience, share your experience with them, I think has been extraordinarily valuable.
It's worth a lot to combine the 2 conferences, to have the patient conference together with the clinical conference. So networking in this small EB community is even more fruitful, and yeah, exchange of ideas is the most important thing in this community, I think.
We're very much an organisation which is there to facilitate and help rather than to be sort of top-down telling people what to do. We are on the verge of, I think, really major changes in what's going to be available clinically. And one of the things that we in Debra International want to do is to try and support both in terms of funding, but equally importantly in terms of encouragement and in identifying patients for trials. So I think we're going to see a big change over the next 2, 3, 4, 5 years in what's going to be available.
By bringing together all those people, we can really start to drive forward new treatments. I mean, for the last sort of 15, 20 years, there's been a lot of research into the science of EB, but now we're actually at a stage where we can start to translate that into new treatments for people, and that's really exciting. It's, you know, fundamentally important.
I think each year we're seeing big step changes in what has been achieved in research. Today we've been listening to the development of the clinical best practice guidelines that I think can make an enormous difference to people with EB. And you're seeing each year, you're seeing greater levels of teamwork around the globe to try to improve the condition EB. Our goal is to find a cure for EB. So each year we've always invested in clinical research that gives us understanding about the condition, and as time goes on, our new strategy is to focus on clinical trials where we can see people with EB actually taking part in professional ways to actually trial out all of the understanding we've gained. We have a dedicated community support team, and this is a group of people who are in contact with the EB community on a day-to-day basis to help them.
I think we're going to see a continued growth in membership. You know, we've now got 50 countries. We used to be very much centred on Europe, North America and Australasia. Now we see groups forming in Asia, in North Africa, very strong in South America. So I think that's going to continue to grow. And that's important not just in order for the organisation to grow, but actually importantly that each time there's a new Debra, we've got something on the ground that can really provide support and advice and help to people with EB in that country.
There doesn't seem to be that many patients that come to the conferences. I think they're more designed for professionals, but I definitely think there could be another section added on where it could be for patients to find out more information, or even to just sit down and have a chat and share ideas and things like that.
How lonely it is when you've got EB. And of course you don't really think about EB in terms of loneliness when you're at the Debra conferences, because everybody's there and you're talking to them and sharing experiences. But the reality of EB is most of the time you're living with it either on your own or with your parents, and it's really hard work and it's very lonely. And I think that's one of the reasons why Debra is so successful, because you need to come together, and it's very hard to find people who understand EB. So, and the really profound implications. So when we're together, it becomes a family, and I think that's why Debra UK became successful, and I think that's why Debra Austria is successful. The families grow and they nurture, and so I really hope that we get the structures right. That family is really going to embrace the whole world, and we're going to do some amazing things together.
To make sure that we don't duplicate efforts. So we need to talk, we need to exchange ideas, we need to collaborate a lot, to move forward and not in circles.
I think the mental health side of things is something that Debra could look at a little bit more, because we've got so many professionals treating the body, and that's really fantastic. But I think sometimes people forget about the mind, and I think they forget that you go through bullying because of your skin, and you go through times when you think, am I going to be able to have a job, and you think, am I going to have a relationship? And I think they need to realise that those need to be addressed as well. So I think looking at the more mental side and psychology side is important.
I think it's given us a great opportunity to learn about the updated changes that have happened in the EB world, meeting new people who have given us new ideas and new techniques that we can use, and sharing new techniques with others as well, so they can go home with them.
I spoke about relationships, and I was saying I've spoken to a lot of people with EB who find it difficult to believe that they will be able to have a relationship because of the way their skin looks, or because of their blisters and wounds and everything. And I think it's just positive reassurance and confidence, building that up in people, especially from a young age, maybe from age 10 or something, just to say, you do have really good qualities, you're not just EB, there's a lot more to you than that. And I think starting that from a young age is really important.
I'm a strong believer that actually if people are having a good time, they will start to mingle, and some of the best ideas actually come around whilst you're having a drink in the bar with your colleagues. So to me, all conferences should have a very good social aspect to them, because it's the best way of networking. The world is such a small place. You realise how small the world is, rather, when you come to somewhere like this, to this particular conference, and you see that everybody has the same shared interests. And it's nice to be able to put a face to a name, and when you're emailing somebody in a different country, you actually feel as though you know them much better. So I think the social events actually help a huge amount on that front. So we started off with a drinks reception in a typical English mansion house, and then we went to an Italian pizza restaurant on the first night, and that was all very good fun. On the second night we had our main social event, which was actually a party boat on the River Thames. We had about 200 people on the boat. We had a disco, a 5-piece jazz band, and there was quite a bit of alcohol flowing as well, but lots of dancing and lots of good fun was had by one and all. And it was also amazing weather. The weather was kind to us, and we saw some amazing sights of London as we went up and down the river on the boat. And last night we went for wine tasting at Vinopolis, and then we had a meal there as well. Again, it was just lovely. There's not one person who's been on their own. Every time that I've looked around the coffee areas or the social events, people are always talking to other people. So there's some countries were represented just by one delegate, but that one delegate was never on their own. So it was just absolutely amazing. And I think the social events really helped to get people relaxed and get some of the best ideas flowing.
It's an inspiration. It's just great to see just how much we're expanding and getting better and getting the word out for the condition.
I found this really insightful, and it's been great meeting so many people from all over the world and seeing how they cope with EB and seeing so many professionals who look after people with EB.
I always say Debra is just the most amazing organisation, and it's a privilege to be part of it.
And when you think we've got 36 different countries, well perhaps more than that, maybe hitting 40 now, all joined together in one happy world, EB world, Debra world, it's quite awe-inspiring.
I can try to make a difference for the lives of people with EB.
I'm gonna sing, I'm gonna dance.